Hello and welcome to PHM 6110. For today's class, we are going to discuss cultural values and ethical framework in healthcare, with our focus being mainly the US healthcare system. So we have three learning objectives for this course. The first is we're going to assess the American cultural anthropological values and kind of look at what that means with the healthcare delivery in the US. Secondly, we are going to evaluate justice and equity in healthcare. We're going to look at it from the lens of a number of theories. Ethical theories. And then lastly, we are going to look at ethical implications of stakeholder decision in how healthcare gets assessed and and the quality of the healthcare that is delivered. So let's start with the first learning objectives. Same as the previous module, I'm going to do three videos. Each video is going to be for each learning objective. So for this video, I'm going to focus on the first learning objective, then there will be two additional videos that's going to focus on the second learning objective and the third learning objective, respectively. So let's start with the first. And we're going to look at what cultural anthropological values mean for the US. So, in general, when we talk about cultural anthropological values or cultural anthropology, we're kind of looking at the shared belief, norms, or practices that shapes society's identity and behavior. And this also shapes how they perceive health and how they engage with the healthcare system and how they interact with healthcare providers as well. I'm going to use an example from my home country. So the Christianity very very heavily influences the how people view illness and sickness in Nigeria. And I remember for a very long time, when people say I'm well, what they actually mean is that they are ill or they are sick, because of the cultural belief that by saying I'm sick, you are kind of speaking sickness into you, which is very very weird because you're already sick. So what else are you speaking? But yeah, that was what the value was, that you had to say I'm well because in this sense you are speaking wellness into yourself. Yeah, so that's how that cultural normal practices work. So when a person who holds this sort of practice or belief goes to a healthcare provider, they're going to say I'm well instead of I'm not feeling fine, or I have this, I have aches and pains and stuff like that. A healthcare provider who understands that this is the cultural value and practices around perception of health is not going to insist that the patient says I'm sick in order to offer help. So they are going to understand that by saying I'm well, the patient is really telling them that they are the exact opposite. So that's giving you an example of how these anthropological values does affect healthcare, perception of healthcare, and how individuals interact with the healthcare system. So with the U.S. anthropological values, there are a couple of them, but we're just going to look at personal responsibility, freedom of choice. This value creates a system that is influenced by individualism, by market driven principles, and innovation. I'm going to talk about this in general, but just kind of wanted to introduce that a little bit. So these values do not just, it's not like something that is harmless to an extent. It's not something that is harmful, really. It's just that the fact that they exist has influence on population health and population health outcomes and in the way that healthcare is delivered, which then means that it does, in one way or the other, especially when we're looking at it from population health outcomes. This anthropological beliefs contributes to health disparities, or it exacerbates existing health disparities and creates challenges for public health initiatives. The one of the reasons one of the ways in which it does that is because these values influence how healthcare systems are designed and how providers deliver care to patients, as well as how patients engage with health services. I'm going to talk about this a little bit in give you more context for this, but just to give you an idea of this is how these anthropological values does influence the healthcare system. So, starting with individualism, I'm going to speak about three of them. So, I'm not going to go into details about each anthropological value, but this is just to give you an idea of what I mean in terms of how anthropological values influence healthcare system in the US. So, with individualism, there's a lot of focus on personal autonomy, on self-reliance, and it does promote individuals taking responsibility for their health and taking responsibility for the decisions they make relating to their health. So one of the impacts that it has in terms of population health, or how it extends to general healthcare uh, behavior, is that individualism drives policies that support consumer directed healthcare plans. For instance, you have with insurance, there are different types of plans. You have the high deductible plans, you have the low deductible ones, and then you have the health savings accounts and all of that. What happens with that is that it gives people like the choice of, okay, do I go with a high deductible plan or do I go with a low deductible plan? Someone who feels that they rarely go to hospitals, that probably they're only going to visit the clinic once a year or just for the preventive services, may decide to go with the high deductible insurance because they know they're probably only going to go to see a doctor once a year. And because high deductible plans have lower premium, it would be for them, okay, fine, I'm going to do this, and as a result, should I need to go to a hospital, I don't have to pay the full cost of it 100% out of pocket because I have an insurance, but I'm not having to pay a lot of money on the insurance because my insurance premium is low because I have a high deductible insurance. I don't know, but what that means is that it's giving individual patients a choice or an avenue to say, this is how I'm going to spend my money on healthcare in a way that let's use, for example, if you had a national insurance system whereby you don't really have any control over healthcare spending, a lot of the services you get is going to be free anyway. And then the ones that you don't, a lot of the money goes out from your tax, and you don't have any control about how much of your money is being taxed, that goes into healthcare. So that's an example of that and how individualism plays a part. So it does encourage direct consumer marketing for that happens with pharmaceuticals. So I'm going to give you an example of how it's very different in the US compared to how it's very different in Nigeria and in the UK, because I lived in the UK for a while. So in Nigeria, you don't mark pharmaceutical companies do not advertise on TV. There is no adverts that happen with pharmaceutical companies on TV. That doesn't happen. In the US, every three adverts is pharmaceutical company advertising a medication. And beyond that, a lot of what they say in their adverts is that talk to your healthcare provider to see if this medicine or this medication is right for you. It gives a lot of power to the individual when they are interacting with their healthcare provider, because it's saying, this is what I want to take. This is the medication I want to take. And some of the times you're only, interested in that medication purely based on the adverts that you saw. That's not how it happens in Nigeria, for an example. because direct to consumer advertising marketing for pharmaceuticals, it doesn't happen. So what happens is that pharmaceutical companies advertise to the patients, sorry, to the providers. So you have pharmaceutical reps that go to providers to talk to them about, and their decision making about which medication to prescribe to patients is what is left to the hands of the provider. The provider is the one who prescribes the medication to you, because as a consumer, you don't know much about the medication to begin with. So you kind of have to rely on your provider to tell you which medication is good for you. So this is to give you a very give you an example of just how different it is with particularly in this area, in this part about direct to consumer marketing. So individualism is, like I said, it's not like every is bad or is good. You know, there are positives to that in the sense that because of individualism, pharmaceutical companies can become more innovative with things, knowing that different consumers can choose either to go with option A or to go with option B. So it has a positive with that. But one of the negatives to individualism is that it, causes a challenge with public health, because individualism unfortunately undermines collective efforts, and this happens a lot with vaccine campaigns or public health guidelines. A very, very good and very, very recent example would be what happened during COVID, the fascination in COVID, and how many people, I think there were some states that went to court and insisted that you cannot mandate everybody to take to get vaccinated. I think a couple of universities did that as well, because it got to a point whereby it was like you either get vaccinated or you lose your job, and a lot of people said that was infringing on their constitutional right, and they could go to court for that. So that is one of the ways that individualism does undermine or has a knock-on effect on healthcare. So another thing that individualism does is that it also undermines efforts to address social determinants of health, because a lot of the focus stays on personal behavior. I'm going to use an example of the challenge of obesity. Obesity is still very much being framed as individual responsibility, with people who are larger being seen as you are fat because you're lazy, or you are fat because you can't stop your mouth from eating food, or you're fat because you like bad food and not good food, that sort of thing, rather than looking at it from a systemic factor. Like, let's use for example, a lot of American cities are not walkable. There's very few walkways that people can walk. A lot of places do not have public transportation systems, which means that most people, if they want to get from point A to point B, have to drive, and all of that limits physical activities among Americans. But still, focus still remains on you are not eating right, that's why you are larger, rather than some of the more systemic factors to say, let's make American cities more walkable, let's invest money into public transportations and stuff like that. So that is to give you, how individualism does play a part in healthcare. The second anthropological value to talk about would be freedom of choice. So, freedom of choice is very, very closely related to individualism, because the American value kind of pushes for people being able to choose what they want, and this happens in the way insurance companies design their care plans, giving you multiple options to say you can either go this or you can either go that, or coming up with new products and new services within that. All it does is keeps giving people choices of where to go, which is a lot of the times these choices are only illusions of choices. They're not really choices. It's just that it's I don't know how to explain it. It's like being having different shades of blue. You're all blue, but whichever choice you make from the different shades of blue is still blue. So it's very much how that happens with choice making, particularly in when it comes to healthcare insurance, in terms of coverage, in terms of providers and treatment. So the reason is because the insurance market makes their options so very complex, and sometimes makes it appear that there are more differences between different choices than they really are. And also sometimes you get so much options of choices, it becomes there's a bit of fatigue that comes with it. So you could just go with whatever it is that the majority of people are going with, whether or not it's better for your health or even the health of a majority of people. So what that does is that it creates confusion, but it also creates disparity for individuals who have limited health literacy, because a lot of the focus is still going towards you making a choice of your health care and your health decisions. For people with low health literacy, they are not really well equipped to do that. So a lot of the times they will not be able to make the best decisions for themselves. So freedom, and this is one of the ways that freedom of choice exacerbates inequities, whereby wealthier populations have greater access to healthcare, and more people who are health literate have better options of making better healthcare decisions for themselves, because they are able to understand some of the nuances that people with lower health literacy are able to. So, freedom of choice also brings challenges to public health initiatives, whereby you have public health policies that still emphasize personal choice over mandates, where you have optional vaccination. To be honest, in of all the countries that I've lived in, the US is the only place where I know that you can opt out of taking measles vaccination. It was insane to me when I came to the US at first, and seeing that people can actually choose not to have their children vaccinated before they go to school, which was just something I did not think until then, until I came to the US, was even an option for anybody. But it just kind of found that, yeah, it happens. So the last anthropological value I'm going to talk about would be innovation and technology. So the US culture values technological advancement, which has been one of the things that has led it to be a world leader when it comes to innovation and technological advancement. What this has done is it fuels a lot of significant investment that goes into medical research, into pharmaceutical development, and into healthcare tools. There's so many people in the US who are very entrepreneur and trying to innovate and find new ways of doing things. So in that sense, it's been really good. And right now, when it comes to technology, especially technology in health, the US, for the most part, still very much are leading. Not to say that other countries are not doing so far, but the US is doing great work in that sense. So some of the developments in precision medicine, AI assisted diagnostics, and robotic surgery is things that have been very good in terms of improving health outcomes for people, for those who have access to this technology. But it does have precision medicine, for example, and diagnostic AI assistant diagnostic has a potential of being very, very doing so much more than it's currently doing. And hopefully it gets to the point where it wouldn't be as expensive as it is now. So innovation is great, innovation is good, but innovation, almost like everything else, especially in the US, is something that resides in people's ability to pay, whereby people who can afford to pay for this innovation and technology, newer technology, gets to have better healthcare, while those who do not have money, who cannot afford to pay for this technological advancement, end up having worse health as a result. So However, the other thing that's also bad about it is that when there's so much focus, because there's so much focus on high tech solutions and very flashy, it makes the news. If anybody posts about it on social media, for example, Business Insider will feature you in their magazines, and you'll be in the front cover, possibly that. All of the focus takes away the good work that primary care or preventive care does. And therefore, as a result, it becomes underfunded because so much more of the focus becomes on innovation, becomes on curative service. They get to be flashy in a way that primary care or preventive care isn't. So what that then does is that it its primary care is not able to do what it's meant to do, which is to mitigate chronic conditions before they escalate to the point of there being need for tertiary care. So this all the U.S. anthropological values lead us into market justice in the U.S. healthcare system. I talked about it in the first slide in the first module, and I'm going to talk about it a little bit, just a bit of a reminder. The U.S. largely operates as a market. The U.S. healthcare system largely operates as a market system. It is an imperfect market, like I talked about in the first module, but it is largely a market system. So let's kind of talk about what we mean in terms of market justice in the U.S. Healthcare. So, market justice is more or less like the view that healthcare is an economic good and should be distributed based off of market forces. What this does is that there's a lot of emphasis on individual responsibility and one's ability to pay, which, like I mentioned, I said, relies a whole lot on individualism. It relies a whole lot on freedom of choice, but also fuels innovation and technology, which influences one's ability to pay. So the US healthcare system reflects market justice for the most part, because access to healthcare, especially the best healthcare, is so much more based on one's ability and willingness to pay. So the good part of it is that it encourages competition among providers, where you have pharmaceutical companies trying to undo each other, and it drives innovation. So that's the good part of it. However, what that also means is that it drives costs of medication, costs of healthcare for consumers, and therefore leading to inequalities or worsening inequalities, especially for those who are uninsured or those who cannot afford to pay. So, one of the major challenges with market justice is that it fails to address broader issues of social determinants of health, or sometimes just simply ignores it and pretends as if it doesn't exist. So, that's one of the major challenges with market justice. So, the by and as so public health programs end up being underfunded because there's so much more emphasis on profit-driven systems. So public health programs are being seen as money that's going away and is being wasted, rather than looking at it in terms of if most people in the country is healthy, then we are all healthier, but rather looking at in the same in this from the lens of all of that money we're spending in this, nothing comes out of it. You're not spending, let's use for example, you're not spending 5 million and getting 10 million at the end of the fiscal year. Because of that approach to public health programs not being profit driven, in a place that has a lot of anthropological value towards innovations and business and market forces, it's being seen as something that is a waste of money and therefore being underfunded. This thereby limits public health interventions, with there being so much more push on individuals making the right decisions for them, rather than consideration of how does this negatively impact society. So that's with market justice. Sorry, market justice. So on the other hand, we have social justice. Social justice in healthcare looks more at equitable access to healthcare service. It emphasizes fair distribution of resources, and it aims to address systemic barriers that perpetuate health disparities. From the lens of social justice, society has the responsibility to make sure that everybody is healthy, right? And as such, it advocates for a government-led initiative that helps to solve the problem that market justice created. So it's more or less like trying to use a government-led initiative to fill up the gap that market justice creates. Because market justice is focused on how do we make the most money and how do we get people to make the best choices for them, and therefore leans more towards people who are willing to pay or people who are able to pay. Social justice kind of pushes for more government-led initiative to take care of the people who are not able to pay for those high-end services that those who are able to pay can afford, which is why we have programs like Medicaid, Medicare, and CHIP, which operates on social justice because it tries to help reduce barriers that vulnerable population face on the market justice system. So, some of the core principles of social justice is equity. It's all about providing resources that's based off on, the need in order to achieve equity in healthcare. It emphasizes on access, trying to ensure that all people obtain affordable quality healthcare. It encourages participation, particularly in decision making in marginalized communities, to get them to have a say in how they're supposed to improve their health. In that way, it's more sustainable for the healthcare programs that are implemented in their community. It also emphasizes human rights. I remember back when they were still debating Affordable Care Act in terms of getting it passed. There were a couple of people, not politicians in this case, like neither, they weren't like speaking from being Republicans or being Democrats. These were just people who were arguing very seriously that healthcare was not a right, that healthcare was a privilege. So this was the kind of conversations that were happening with normal people in the US. A lot of that being pushed by individualism, being pushed by freedom of choice and stuff. So the social justice kind of goes the opposite direction by saying healthcare is a fundamental human right. It's not a privilege. It's something everybody should have. So, but that said, the U.S. healthcare system is not purely based off on market justice. It does have a combination of market justice and social justice, and that's kind of creates a tension in terms of whether we are focusing on equity or whether we're focusing on profitability, with different stakeholders pushing for whichever one that they kind of align with. So that is how that works. So this is a summary table that compares market justice with social justice. This is from the textbook. You guys can go into the textbook and have a closer look to that in case this is too small. So that is the summary. Looks at it from characteristics of market justice versus social justice, and also looks at it in terms of implications for both of them. So this is where we end with the first learning objective. We're going to come back and talk about theories of justice and equity with the second learning objective.